one of Mary's faculty members called us and said, "You ought to come out and look at Missouri. It's a really nice place." And we said, "Where?" And
not quite.
Sort of
we knew
got out
where it
here
was.
and got a map out and see where it was. And so we came out here for residency, did that, and then left and went to Duke for 3 years after we finished that. And then we got done at Duke, and we said, "Got to find a job someplace." So we said, started looking around, and said there weren't a lot of nicer places to go than Columbia, so we came back, and that was 37 years ago.
Yep.
And we were both on the faculty at the university, and after about a year I left to start a practice. And I'm probably one of the, I don't know if I'm the last one, but there aren't many doctors left who sort of just go to the bank and borrow money and start a practice anymore, but that's where it was. And at that time it was just one nurse and we had 2 other people in the office, and that was it. There was kind of a void at Boone, and I was trying to build a practice. And so I started seeing more patients over here, and finally built really very sizable practice out of Boone. So I became much more localized fairly quickly at Boone. I've always felt really at home there. The doctors are very friendly, the staff has been wonderful, and it just felt like a really good place to be practicing. After we had an older son, and then our twins were born, and after that, you know, working 60, 80 hours a week was kind of hard.
It was nuts. Yeah, because he kind of lived at the hospital.
And work over here. So outside of those few years, we worked probably about somewhere between 5 and 10 feet from each other for the entire 3 decades, 36 years.
A lot of it was like ships passing in the night.
Sometimes,
but
I mean, you know,
but it was better than that.
It's interesting. So it's been a very satisfying and just gratifying, really. Our patients are wonderful, and you know, they're just so nice and easy to work with.
There are wonderful people who do what you tell them, who try to get better, who make the best of things, and always make you feel good, because they're always, you know, it could be worse, I can do this, and they just lift you up and make you feel like, boy, I hope I can be like that, you know, and wonderful people.
I went on the board of the foundation 6, 8 years ago, maybe, something like that.
I was
have
thinking
to ask
8
them,
or 10,
you know, because I served 2 terms, having been on the staff for so long. There's a little bit of a different perspective in terms of what people needed, what patients needed, and so on. So I gave them, hopefully, that kind of perspective that they didn't necessarily have. There are certain things where you just can't justify an operational expense to run the hospital. You don't need it to run the hospital, but you find that there are things that would really help the patients feel better and do better. And of course, one of the things I've always been close to is the supportive care, palliative care foundation. But the other things, you know, the heart things, the babies, you know, the swaddles, and you know, the pillows that the heart patients get, and things like that that really sort of matter a lot to patients, but you can't really justify them in the operation of the hospital. So there's so many of those things that come up that people don't realize that you have to be funded, right?
I'll tell you, this retiring is driving me nuts, because I love the patients, and it's like I'm gonna fall off a cliff. No, I mean, you know, so I'm getting a lot of their phone numbers and emails, and I know there's some whole group of women in Jeff City who are all plotting when we're all gonna go out to eat, and they're gonna make sure I get to come.